is the diagnostic imaging sort of crisis we have on the island. Like when you're talking about ultrasounds and MRIs, people are waiting too long. This is just one of the areas, but again, it really seems to me like there's a huge opportunity here to just allow for people to go to private services off island as close as Moncton and just have government, pay for them to do that. And it boggles my mind. I just don't understand, other than perhaps the monetary side, what are the barriers to stop this from happening?
Every province in Canada with their publicly funded healthcare system doesn't allow you to do that. So if I were in Ontario and I went to Montreal to get a CT scan from a private clinic, I'd be paying for it. So PEI is not unique in that. I do think we need to have those conversations. So I'm not putting barriers up to those things, but those things are way bigger than me. These are legislature conversations, right? Where do we want to go with this stuff? So I don't have any issue with that at all. But this is where people criticize the move towards more private medicine. So for example, there was a story in the news in the Globe and Mail this week about a person who was waiting too long for shoulder surgery, flew to Alberta, got it done in a private clinic, came back and said to OHIP, pay, and OHIP said, nope, not doing it. You could have had that done here. Doesn't matter how long you wait. I think it actually does matter how long you wait, and I think we should be having those conversations. I'm just saying it's not unique to this island. Those are things that Canada should be talking about, because right now, it gets involved in transfer payments, right? In terms of the feds can say, well, you had a bunch of stuff done privately, so we're not transferring that money to you as a province. It gets into the Canada Health Act and other issues, but it's worth having those conversations. In terms of our wait times for medical imaging here, they're appalling. They are way, way, way too long. And why are they too long? It has been very, very hard to hire the people that we need to do those jobs. It again comes down to recruitment. And so we should be running our MRI scanner 24 hours a day, 7 days a week. We don't, right? And the limit on that's not money, it's people.
And the people to add the services do exist. They're as close as New Brunswick across there, but we're unwilling to get out of the bureaucracy and the red tape to allow it to happen, and it just drives me nuts. But